Hi guys, my name is Edgar Martinez. I hope all of you guys have been doing really good. I'm here to present to you guys today my informative speech. So to kick it off, the world is going through a really tough time and has come together to win this fight against COVID-19. I know that all of us are probably tired of hearing about this absolutely everywhere, but it is important to listen, stay alert to updates, and take precautions because it can happen to us, to any of us at any moment. This pandemic has stopped the world like we have never seen it before, and it is crucial for us to see the severity and what we can do to help. Unfortunately, somebody really close to me contradicted the virus and affected her whole family, and that just opened my eyes and made me want to get informed and really know what's going on and understand the situation more. The purpose of this speech is not to persuade you to do anything you don't want. The purpose of this speech is to inform you about the situation, what COVID-19 is, how it spreads, the statistics and numbers worldwide, and the recommended precautions to help control the spread. So the first point I bring up to the table is understanding COVID-19. So according to the Centers for Disease Control and Prevention website, also known as the CDC, the coronavirus illness is a virus that targets your respiratory system and can easily spread from one person to another. It was first identified in Wuhan, China, and it has now spread all across the globe at a very alarming pace. COVID-19 comes from a large family of coronaviruses previously known, and it's one of them, but it's a completely different one that we have never seen before. If you took a look at Clorox wipes like before the pandemic or anything like this happened, it actually mentions coronaviruses, but it targets the coronaviruses we knew, but this one, like I mentioned, is a completely different one, and this is why it's been really hard to deal with. It can range from the severity of the common cold to major respiratory problems, as you guys have seen all over the news, and that means we just have to be really careful. Coronavirus spreads in different ways, and we just have to be really careful because you can get infected. The first way you can get infected is if you come into close contact with somebody who already contracted the virus, because the main way it spreads is from person to person. That's the main way. But the second way you can get infected is from the respiratory droplets from those people. So if you're sick, your respiratory, when you cough, all those droplets are released, and if somebody else contracts them, they most likely got the virus, especially if they touch their eyes, nose, or mouth. So we have to be really careful with that. Like I said, if you're outside, don't try not to touch any surfaces and then touch your face, because you don't know if that surface can contain the virus or anything like that. So we just have to be extremely careful. Get some Lysol, just be careful and don't touch your face when you're outside. If you're unsure if you have it, some of the most common symptoms are fever, cough, shortness of breath, headaches, sore throats, etc. It's kind of like the common cold, but it's a little different. The virus is highly contagious, and this is how it gets passed from one person to another, like I said. And since the virus is completely new to us, there's no current cure, but the doctors are working hard to find one as soon as possible. The only way for us to control it is by staying home and letting our immune system try and fight it off, and it usually takes about 2 weeks. That's why we are recommended to self-isolate and quarantine for 14 days, and we must listen to that because that is very important. Thankfully, the virus doesn't have the worst mortality rate, but that doesn't take away from the importance of trying not to get it, but the important thing to know about that is that if you have previous medical problems, it can get bad pretty quickly. So just be careful with that. But on the bright side, according to the New York Times, this week the biotech company Moderna is entering their third and final stage into a possible vaccine against COVID-19. And it is showing some very promising results. We just have to wait and see, and we must do our part. My second point of the speech is to talk to you guys about the urgency and importance of the situation. The outbreak has turned the world upside down, and it is really mind-blowing when we actually take a look at the numbers and see the severity of the case. So according to the website ourworldindata.com, more than 14 million people around the globe have contracted the virus, and sadly, close to 600,000 people have sadly passed away due to coronavirus complications or related problems. This crisis is not a joke. and it's affecting more than just our everyday lives. Our communities were heavily impacted, from our education at the campus being put on hold to millions of people losing their jobs and countless things like that. One of the most important effects that it's taking is that our global economy is suffering a lot. According to Bloomberg.com, like, the total economy can suffer up to $2.7 trillion, not billion, $trillion of that's a huge hit for our economy. And if it keeps going like this, we're gonna experience a recession way worse than the actual Great Depression from the 1930s, and that is bad. Millions of people will lose their jobs and will struggle to maintain their families, and that is just a horrible result of an uncontrolled global pandemic. The first case of Paso was confirmed here on March 13, 2020, and now, as of today, we just passed 11,000 cases. That is horrible. Like, we're getting, as a result of that, 175 people have died, and our numbers have spiked up every single day. So we have to be really careful about that. And yeah, even though lockdown regulations are being eased, we must continue to follow safety regulations and guidelines and do our part to keep our families and communities safe, which brings me to my next and final point. Nationwide measures would decrease infection rates and save the country from another possible round of shutdowns. Now, none of us want to shut another lockdown, which is it's horrible. But healthcare workers are fighting this virus at the front lines, but we should do our part to help the situation too. The government advises the citizens not to touch their face, and if you're outside, you should try to wash your hands. You should try to be clean, and if you're not able to wash your hands, you're able to use any type of hand sanitizer with 60% of alcohol. That's just to keep your hands clean, and just try not to touch your face. The second recommendation, and another very important thing we're advised to do, is practice social distancing. The best way to protect yourself is just stay home. If you don't need to go outside, please don't go outside, because that is really the best way we can prevent ourselves from getting it. If you're not exposed to it at all, there's no way you're gonna get it. And if you have to go outside for the groceries or anything like that, please make sure to maintain at least a 6-foot distance away from everybody. And if you're sick, if you know you're sick, even if it's not COVID or whatever, just stay home. It's not a time to be outside and get people scared. It's just a bad time right now. The third and final regulation the government is recommending is we're encouraged to be wearing face masks. So any type of face mask like this one, the surgical ones, the cloth ones, anything like that works. Just as long as you have a face covering, it truly makes a difference. According to a YouTube video I saw by Vox.com, the effects of face masks, they mentioned that face masks are fundamental in how we fight and contain the virus, and that is something we should really take a look at. If you have to go home, if you have to step outside the house, please wear a mask. Of course, they don't stop you from getting the virus 100%, but if you follow the 6-foot distance, the masks, the washing the hands, those, like I said, they don't completely stop you from getting the virus, but they dramatically lower your odds of getting the infection. So we should really take a look at them. In conclusion, to wrap things up, this crazy pandemic has affected each and every single one of us, and that is why it is crucial for us to be informed of what's exactly going on, the effects of it, and the things we can do to help. Think about all the information we discovered today and stay safe. Like I mentioned before, I saw this as an opportunity not to persuade you guys, but to inform you what the situation is exactly. And since it keeps getting worse every single day, I hope you guys learned something today. And if you want to take a look at the research I took, I'm going to leave all the links down in the description. And just thank you so much for listening to my speech. Stay safe, everybody. See you later. Bye-bye.